嗨，大家好，我是戴初轩，我来自英国，欢迎回到我的频道。今天我要采访我的母亲。Can you introduce yourself?
My name is Catherine, and I'm a doctor, and I've worked for most of my career as a GP in the UK.
So if someone was feeling sick and they wanted to see the GP, how would they go about doing that?
All of the different surgeries are independently run, so things will be different in different practices. Things like how they organise their appointment system will be different in every practice. Lots of surgeries now are doing telephone appointments, lots are doing video appointments, lots are doing still come down to the GP and get seen. But the way you organise that will be different in every surgery. In lots of surgeries you can now book online. What you'll need to do is get familiar with the surgery that you're registered at and how their appointment system works.
So if you want to book a COVID vaccination, how do we do that?
There's essentially 3 different ways that you can get a COVID vaccination. Either you can book online to go to one of the major COVID vaccination centres, which are all over the country, or you can have it at your GP surgery. If you're going to have it there, they will call you and you'll have it done there. Or now there are lots of pop-up walk-in surgery centres that you can go to have it done there, and you need to look in your own area and see where that's being offered and done.
So I received a text message to have my vaccine done, but I don't know.
That came from your GP surgery, I think.
Okay, but it was not at the surgery?
No, because some surgeries are not doing it in their own surgeries. They've grouped together and it will all be done in one central place.
So it's like the surgery organising it, but at a different venue?
Yes.
Someone asked an interesting question, which was, how much do people pay for the NHS every year? Even if you're not sick at all and you don't use the NHS, how much do taxpayers pay for it?
Well, how much taxpayers pay, I think, is unclear. Individuals just don't pay anything for the NHS. It doesn't matter whether you use it a lot or you don't use it at all. You don't pay anything. Increasingly, medicine and GP practices in particular are trying to do preventative medicine. So you may well be called by your GP surgery to come in and have some checks done, such as, for instance, your blood pressure, even if there's nothing wrong with you, because they're trying to pick things up before you develop any symptoms. But you don't pay anything for that either.
But that's not true for prescriptions, right? The prescriptions aren't free.
So there are some things that you do have to pay for. So dentistry you have to pay for, opticians you have to pay for, although some people are exempt. Prescriptions, most adults will have to pay for, but again, there are exemptions. So patients over the age of 65 don't need to pay, children don't pay, patients who've got ongoing particular medical conditions, they don't pay, but everyone else has to pay a prescription charge, which at the moment is £9.35.
So that's quite a lot. So it doesn't matter what drug you receive, you have to pay £9.35. Another big question that everyone keeps asking is, how long does it take to be referred, and is it normal to wait about 2 months to see someone?
Everything has to come through the GP or the GP surgery. The GP surgeries are what's called the gatekeepers into the rest of the system. That's accepting A&E. Anyone can go to A&E. To go to see a specialist, you need to be referred by someone in your GP surgery.
And, like you?
Yeah, but it could be a nurse, or it could be a pharmacist in the practice, or it could be there are lots of other specialists who are starting to work within practice, such as physiotherapists, pharmacists, paramedics. They can all refer in as well.
Oh, okay.
So, but it needs to be somebody within that system. Also, opticians can refer in and dentists can refer in. They can all refer in to specialists, but you have to see them first. And then the waiting lists vary depending on what the problem is and how long that particular department waiting list is at that time. So certain things, such as referrals for cancer, are under a special pathway where you'll be seen within 2 weeks. But other things can be very much longer. And of course, COVID has made the whole situation much, much more complicated.
So if you don't want to wait that long, is there somewhere else you can go, like a private system?
Yeah, so there's a private system that works alongside the NHS that people either go to, they pay themselves, or they have an insurance policy that will pay for them to go to see the private specialist. Often they will ask for a GP letter as well, not always, but often they will, particularly if it's an insurance referral.
What we're going to do now is a little role play where I go and see the doctor.
Hello, hi, how can I help you today?
Yeah, so I've had a cough for about a week now, really bad cough, and it's not COVID. I know it's not COVID because I took one of the tests and it was negative. It's just really annoying me because it's quite a bad phlegmy cough, like kind of bringing stuff up. But
so it started a week ago, and since then Do you think the cough's got better or worse or stayed the same?
It's pretty much stayed the same for the last week. Yeah.
Okay. And when you say you're bringing up mucus, what colour is that mucus?
Just see-through, like
That's
spit.
clear.
Yeah,
Okay.
just clear.
Okay. And have you had a temperature at all?
Yeah, I did have a bit of a temperature. I was kind of hot in the night for a couple nights. That's why I thought it might be COVID as well. I thought it was a fever, but yeah.
Okay. And what about eating and drinking? Are you eating and drinking okay?
Yeah, fine. No changes
Okay.
in that.
All
Yeah.
right. And is it affecting your sleep, the cough?
Yeah, no, it is keeping me up in the night and I
Okay.
can't sleep. That's what's really annoying about it.
Yeah, sure. That is annoying, isn't it? What about a runny nose? Have you had a runny nose?
No, just a
No.
cough.
Okay. Have you had any other symptoms at all? Have you had any vomiting or problems with your bowels?
Nope,
No. Have you
no.
lost any weight?
No,
Okay.
no.
Do you often get coughs or colds, or is this the first time this has happened for some time?
No, that's what's quite strange about it. I don't usually ever get a cough.
Are you otherwise fit and well?
Yeah, I'd say I'm pretty
Okay.
healthy.
And do you take any medications for anything?
No.
No.
Thought it could be some sort of, I guess, like COVID virus type thing, like a flu. So I was thinking maybe I could get some antibiotics.
So what I need to do really is I need to examine you. Is that okay? Right, I've examined you, and the good thing is you don't have a temperature and your oxygen levels are very good and your pulse is good. That means there's not a significant infection going on around the rest of your body. And I've listened to your lungs and they sound good too. There's no obvious signs of infection there.
Okay, great.
So I think you're right. I think it probably is a viral infection. I don't think it's a bacterial infection. So not from what we would call a chest infection or a pneumonia. They're caused by bacteria, and I don't think it's that. And you mentioned about antibiotics. So antibiotics only work against bacteria. They don't work against viruses.
Okay.
So I don't think the antibiotics would actually help you. I know it's tempting to think you want to take something to get rid of it, but I don't think that's actually going to help you. I think, unfortunately, this is going to have to run its course and settle on its own. But it sounds like it's already beginning to improve because it sounds like you had a bit of a temperature at the beginning and that's gone. And it will take a few days for the cough to settle because the cough is the body's defence against having an infection. So you'll continue to cough whilst your body's getting rid of it.
So is there nothing that you can give me?
So I'm really sorry, but I don't think antibiotics will help. And ultimately it's your body that's going to fight it off. But there are some things you can do that will help potentially. You could get some cough medicine because sometimes that can help you bring up the phlegm a bit better. And then it makes the coughing settle for a while if you bring up the phlegm more effectively. The only other thing you need to watch out for is just sometimes you can get a bacterial infection on top of the viral infection. So you'd know that was happening because you get a temperature again, you would be coughing worse, it might be green, probably feel unwell and maybe need to be in bed rather than up and about. And if that was happening, you should come back because it may be that you do need antibiotics at that stage. But the chance of that happening is very small, so we wouldn't give antibiotics just in case. So you can go to the pharmacy and talk to the pharmacist and they'll advise you about the best cough medicine to have.
So that concludes our Seeing the Doctor episode. If you have any more detailed questions, then definitely we'd recommend that you see your own doctor at your GP surgery. So yeah, we'll see you soon.